Now, Vice Chancellor of the University of Health and Allied Sciences, Professor Lydia Aziato, has asserted that the exodus of health professionals would impede effort towards attaining Sustainable Development Goal 3, that's universal health coverage. She wants stakeholders to design modules to lessen the migration of health professionals. She was speaking at the opening ceremony of the 4th Annual Nursing and Midwifery Leaders and Managers Conference and the 3rd Excellence Awards in the Volta Regional Capital of Hull.
The Ghana Registered Nurses and Midwives Association reported that about 4,000 nurses migrated from Ghana in search of well-paid jobs in 2022. This was fueled by Western countries recruiting nurses, leading to Ghana losing a significant number of nurses. Addressing the 4th Annual Nursing and Midwifery Leaders and Managers Conference in Hull, the Vice Chancellor of the University of Health and Allied Sciences, Professor Lydia Aziato, lamented the development.
I'm also attracted to universal health coverage. Before we started, I came earlier, so I was engaging some of you, and I asked some of you whether you have nurse specialists in your facilities. The answer was no. Somebody said we had one who went to school, but the person has migrated. So I was asking myself, how would the institution now have the confidence to sponsor or allow another person to go if the first person did not come back? The important people are here for me, and the question I want you to discuss at the end will be recommendations not to stop migration, but to moderate it so that we can have experienced, qualified, dedicated nurses and midwives caring for me when I become sick one day, because I don't know where I will need the service, okay?
The country representative for the United Nations Fund for Population Activities, Dr. Wilfred Okan, admonished leaders in the health sector to adopt best practices towards achieving transformational change.
The 4th and last path, I see nurses and midwives freely associate under professional association or are registered as members with active association branches. There's one united association with one unequivocal voice of representation. The leadership and members are united to advance the interests of the association, including professional development of the members, advancing the welfare of members and better services for the target population.
The Chief Director of the Ministry of Health, Alhaji Hafiz Adam, called for unity in the country's health workforce.
As a ministry, it will not augur well with us if we continue to see a divided 60% cadre of the health workforce. It will affect quality care, no doubt about that. Our ministry, through the Office of the Nursing and Midwifery, is therefore mandated to provide oversight, responsibility, coordination of policy, planning, monitoring, and evaluation of all health sectors.
The conference would provide a platform for the discussion of several policies and programs aimed at enhancing healthcare delivery in the country. Fred Kwame Asari, Joy News. Ho.